All right, so super short. Chapter 28, heart disease. Basically, we can skip this. There's one medication for coronary artery disease, heart disease, and that is nitroglycerin. So, super easy. Expected use is when you have chronic chest pain or angina, or a sudden onset of angina. That's obviously due to the occlusion of cardiac arteries or whatever, coronary artery stuff. That's what I was trying to say. Coronary arteries. So you can take it as a prophylactic, like before something that's going to cause angina. Anyway, so there are your reasons there: CHF and acute MI, and then controlled hypertension during surgery. So those are expected uses. So the expected action, which is what we really need to know, is vasodilation. It increases the heart rate and contractility. Okay, so again, expected action of nitroglycerin is vasodilation, increases heart rate and contractility. It's given for chronic angina. That's really it. People who have like occluded coronary arteries, basically. Adverse side effects is hemodynamic changes, preload, initial stretching of cardiac muscle reduction, severe headache, bradycardia, syncope, orthostatic hypotension, nausea, vomiting. We didn't have any of that highlighted. Cautions, contraindications are anemia, hypotension, hypovolemia, fluid retention, joint pain, tachycardia, MI. Precautions with stroke and renal and lupus. So those are your cautions and contraindications for nitroglycerin. Again, none of those are highlighted. Here's what is highlighted: nursing considerations. You got to monitor for orthostatic blood pressures, then taper the dose. MAOIs for 14 days. Remember, MAOIs, you just don't do MAOIs with anything. We've already been through this. You want to take this at the onset of pain every 5 minutes, but not more than 3 doses. You need to be on your way to the ER when dose number 3 goes in. So here's the thing, is you have to put this under the tongue, sublingually. That's why we have this little doodad, Rolling Stone's mouth up here in the corner. It's best to wet the tablet with saliva before putting it under the tongue. So if you find somebody having severe chest pain, lick it and stick it, all right? Put it under their tongue, and hopefully that helps them up, and you can get them to the hospital. So again, take the onset of pain every 5 minutes, not more than 3 doses, then go to the ER. And it's got to go under the tongue. Chapter 29, shock and hypotension. So the opposite of some of the stuff we've been talking about earlier. Basically, there's 4 types of shock: hypovolemic, cardiogenic, obstructive, and distributive. But that does not matter because there's only one medication that we really need to know. And you can go through those and learn them if you want. But the medication is norepinephrine. Okay, so think about it like an EpiPen or adrenaline or whatever else. Basically, it is going to cause some crazy vasoconstriction, so that's the expected action, as potent peripheral vasoconstriction. That is going to wake everybody up. It's basically like a stimulant. Anyway, so adverse side effects. What we have here that's highlighted is diminished renal and liver perfusion. Then there's irritable heart, hyperglycemia, hypokalemia, hypertension, reflex bradycardia, limb ischemia, extravasation at infusion site, headache, nervousness, GI distress, and angina. So, okay, let's break that down. Again, the only thing I've highlighted right now is diminished renal and liver perfusion, but if you basically just get a shot of adrenaline, your heart's going to beat super hard, so irritable heart. Hyperglycemia, I don't really know the pathway or why that's going to do that. Hypokalemia, again, don't know why it's going to lower potassium. Hypertension, that's understandable. Everything's tightening up, so your blood is going to be pushing out from the inside of your blood vessels, and that's going to cause that pressure to go up. Reflex bradycardia, don't know why that's going to happen, but whatever. Limb ischemia, so something that happens if like someone gets a limb blown off is shunting, which is like your body's way of cutting off the blood supply to what it deems unnecessary, which are your limbs first, and then everything else goes to your vitals. So there's that. And then headache, nervousness, GI distress. If you take too many stimulants, like even caffeine, you're going to shit yourself. So think about that. And then chest pain. So there's that. Cautions, contraindications. Cardiac dysrhythmias, angina, hypertension, hyperthyroid. That one is highlighted. Cerebrovascular disease, increase IOP, and allergy to sulfites. So hyperthyroidism is the one contraindication that we have highlighted here from my notes. And if you think about that too, we've already talked about hyperthyroidism. It's like being sped up super fast. Your heart's already beating too hard. You're already sweating. You have heat intolerance. You have all these other things that go along with just being like wound for sound and acting crazy. And this is going to just exacerbate that. So that's why it's highlighted as a contraindication, and I would suspect that you're going to need to know that one. Nursing considerations, infused with dextrose. It comes usually, I looked that one up, it usually comes like in a pen, like an EpiPen, and it's already got the dextrose in it, and that has to do with the stability of the molecule and its breakdown in the body. So that's why that's there. It's going to be, if you're administering this drug, it's probably already going to have the dextrose in it. Monitor input and output and blood pressure, and then protect from light. So protect from light, you can lump that back up there with the nitrates. Inputs and outputs, diminish renal and liver perfusion. Well, if you think about it, if it's a severe vasoconstrictor, the arteries and veins that feed the kidneys and liver are also going to constrict, and so the blood supply to those isn't going to be as good. As those things constrict, especially the renal side of things, the amount of fluids being filtered out by the kidneys is going to decrease, and so will your output. So you're not going to pee as much. Your blood pressure, again, vasoconstriction is going to cause the blood pressure to go through the roof. So just think about those two things. Less pee, higher blood pressure, probably going to happen here. Dextrose is already going to be in it. And then hyperthyroid, you're already sped up. So that is chapters 28 and 29 in a nutshell. You only need to know nitroglycerin and norepinephrine. So there we go.